It's finally We Day in India. Over 1,65,000 healthcare workers got vaccinated today across the nation at 3,006 sites. From fighting the pandemic to taking the silver bullet to allaying citizens' fears, our healthcare workers have been at the core of war against COVID-19. Here's the beginning to the end. Here's a report on what the mood looked like across the nation as India made history.
Day one of world's biggest vaccine drive. The frontline warriors on Saturday got their first jab in the midst of a round of applause. Around 3 lakh healthcare workers took the silver bullet at 3,006 sites across the nation, as 100 beneficiaries were vaccinated at each site. Those who got vaccinated say the process was painless and totally safe.
What was your experience like, sir, getting the shot?
Well, the first shot was absolutely smooth and painless. And I'm honored to be among the first ones to be allocated a slot for getting the vaccination. And I think that me and my colleagues need to get this so that, one, we are de-risked because obviously we are at the highest risk being on the front line. But more importantly, we need to serve as examples for the rest of the country that they should embrace the concept of vaccination. They should not hesitate or be afraid. It is safe. We've just got it. We are doing well.
Do we know what vaccine you've got? Does it make a difference whether you got the Covishield or the Covaxin?
Personally, to me, it makes no difference because both the vaccines are safe. There is some data which is expected from the second vaccine, which is the Covaxin. But the safety is not an issue at all.
Mood was no different in Mumbai. The first 100 beneficiaries gathered and took turns to receive their jabs.
A big day today, indeed. The vaccination drive kick-starts today. Now, I'm at the Narendra Hospital in Mumbai, and the people here are a special lot because they are the one who are going to receive the vaccine today, and they are going to, of course, set an example. But the first person at the Narendra Hospital who's going to receive the vaccine is a lady here. Ma'am, many people have been, a little skeptical about whether they should be going for this vaccine or not. But you being a professional in the medical field, what are your thoughts at this point of time? You're number one here in the list. You will be taking the vaccine first.
Yeah, I feel that all healthcare workers who have been tested for COVID, because we also take tests in our hospital, whether we are positive or negative, then only we are allowed to work. So since I am COVID negative, I want to take this vaccine so that I protected myself to give service to the other patients.
In Chennai, more people signed up to get the vaccine than expected.
COVID vaccine has been initiated, and the drive as per that. The first vaccine was given to a health worker in Madurai and the second one at Rajiv Gandhi Government Hospital in Chennai, and the second vaccine was given to the Dean of this hospital, Tenari Rajan. You could see currently various other people also, very frontline workers are also getting the vaccine over here, and this is a place where you could see actually all the setup was earlier done. 2 dry runs had been done already over here, and one by one the vaccine is being given to them, and the officials here have mentioned that the time span for the vaccines to be there is a maximum of 4 hours.
To build the confidence among the healthcare personnel, I wanted to stand first. That's why I took the vaccine first. And we are all very happy. And our healthcare personnel also, they are very confident now.
Similar scenes were witnessed in Hyderabad. The state government hailed its healthcare workers for their sacrifices and services in the war against COVID.
Doctor, you have taken the vaccine, so first shot of vaccine.
Yes.
How are you feeling now?
I feel great and I feel very much empowered.
And there are several doubts about vaccination that you might develop some kind of allergy, some kind of issue. Any issue, anything you are feeling now?
Absolutely not. I feel stronger than ever before. First message I want to give is vaccination is safe. COVID vaccination for COVID with Indian vaccines is safe.
The spirit was high in Jammu as well.
No, there was no nervousness at all. In fact, I was feeling very nice and peppy about it because I was waiting for this vaccine for since long. Not only me, the entire country was waiting for this vaccine since long. And finally, the day has arrived when we all have been blessed to get the shot finally. We should trust our country. We should trust the manufacturing of the vaccine in our nation, which has been done by the Serum Institute of India, Pune. We have to look at the brighter side of the medicine and the drug rather than looking at the negative side of it.
As the days go by, more frontline workers, a total of 3 crore citizens, will be vaccinated in the first phase of the drive. Next in line would be elderly and people with comorbidities. After months of gloom due to the pandemic, a billion hopes now rise with the beginning of the vaccination drive. Bureau Report, India Today.
All right, let me go to our guests joining us. Those who have got the first shot today, they're quite elated, excited. I want to know their experience. Let's take a listen to them firsthand. Dr. Shashank Joshi, member of the COVID Task Force, joining us from Maharashtra. We also have Julie Shaju, nursing head, Meteor Hospital, to give us a perspective. Let me start with Shashank. Why don't you give us your take on what happened today? How is mentally after receiving the first shot?
I think physically and mentally we are perfect. I don't think there's any challenge. I was very convinced, and I always said on record that I didn't mind taking any vaccine. And it is safe, it is effective, it is immunogenic. There is nothing to worry. It was just a little small jab like any other ordinary injection which you get. And after that, I'm feeling fine. I took it at 12:47 and I'm good. So I feel very happy that I was a part of this historic moment. And the reason I was called, especially by the state government, was to motivate all healthcare workers and allay all their anxieties that there is nothing to fear about both these vaccines. These vaccines are safe, they are effective, and they are immunogenic. And we need to protect ourselves.
Great. Of course, what vaccine did you get?
Covishield.
Covishield.
At the seat was Covishield.
And you're saying no side effect, not even the slight fever, slight swelling in the arm. That's what doctors told us would happen.
It's 8 o'clock, it's 8 hours after my vaccination, and I'm feeling good, and I'm feeling, as you said, mentally and physically perfectly fine. Good to go.
So literally no slight temperature, nothing?
Nothing, absolutely. You can see me right here.
All right, fantastic. I'm going to ask you the process of the entire registration and how you got the vaccine, if you had to wait in line, whatnot. But let me quickly go over to Julie Shaju there. Julie, take us through your experience. What vaccine did you get and how are you doing mentally and physically?
I took vaccine today. We were so excited to take the vaccine, and after the shot, we were so relieved. I'm really happy to get vaccinated.
What vaccine did you take?
Covishield. I took Covishield.
Okay. And did you have any temperature, swelling on the arm, anything at all?
No, nothing. I am completely all right.
Nothing at all?
Nothing. I am completely all right.
All right.
Bilkul.
Julie, what's the confidence that you have in this vaccine? Do you feel this is going to shield you from coronavirus? Do you believe, have you read enough about it? Do you trust this vaccine enough to motivate the others? You've taken it undoubtedly, but what is it that you have to say about this vaccine?
I'm completely, I'm 100% confident I have. I request everyone to be vaccinated against this virus and protect ourselves and our family members.
Okay, let me ask Shashank. Dr. Shashank, take us through the process. It started at 9 a.m. What time did you get the vaccination shot? What was the process like? Did they verify your documents? Did you have to wait in line? Was there an observation room after you got the shot? Take us through stage by stage, please.
Right. So I think the SMS never came, which we all were waiting for.
Okay.
So they had to check on us because I think the Covan, the app was very slow because I think everybody logged on to it.
Okay, so you felt the app was jammed?
We had to show our identification. We had to carry our Aadhaar and PAN card that was verified physically. They gave us instructions, asked us about our allergies. After that, we were taken to a vaccination room, which is a dedicated vaccination room, where we were given the vaccine. After giving that vaccine, I was made to wait for almost 35-40 minutes in an observation room. And after that only we were released. While we were vaccinated, after the vaccination, in fact, I have that video live also and I can send. The nurse was very kind. She told very clearly COVID appropriate behavior precautions. She said, sir, you cannot stop wearing the mask. You have to be distant. You have to follow sanitization. You have to come exactly after 1 month back and get your next shot in. And if there's any problem, they gave us a number where we can report. And today evening, they again called me up and found out whether I was doing okay or not. So this is the whole system is reasonably foolproof. And I feel very reassured and confident that they were taking care of all of us in the same way. And obviously, initially, a lot of people I saw were very apprehensive. But after the whole process...
And that's precisely what's happening all over. A lot of skeptics there, a lot of rumors, a lot of propaganda, politically and otherwise.
Just don't get apprehensive. This process is hassle-free. It's extremely smooth. It's a wonderful experience. And I think it's something which we should be proud about. So just
all right, Dr. Shashank, you call it a wonderful experience. It sounds so pleasant to the ears. I'd like to ask you, how long did this entire vaccination process take? When did you reach there? And how long until you got vaccinated and got out? What to expect?
I think I reached there somewhere around 11 o'clock and I got out somewhere around 1:45.
Okay, so around 2.5 to 3 hours.
I was happy and I was cool about it. So I think I was there with Dr. Hari Shetty, Dr. Rahul Pandit, Dr. Gautam Bansali, and we were there to make an example to our other healthcare workers to motivate people. So I don't think it matters. See, we have to be patient at times.
No, I get it. Undoubtedly, you're also a member of the COVID task force. So you've, who better to speak about patients than yourself? You've been overseeing COVID patients, trying to streamline the process even before the vaccination was out. But what we'd like to ask you is, for people who get there, is there a process in terms of what time, if I'm a frontline worker or healthcare worker, if my name's on the list, what time am I supposed to be turning up at the center? I can't be waiting right from the start of the day until the end of the day, right? So how do I know when will I get vaccinated? Is there a time slot that they give you?
So they give you a time slot, and most people are out, if you take that mandatory 30-minute waiting time, most people are out within 60 minutes to 70 minutes.
Okay, so about an hour and a half you keep as buffer.
Yeah,
that's what you say.
I think that's what you think.
Excellent. All right, let me ask the same to Shaju. Julie, take us through your process of vaccination, right from the time you went there, what time you got out, and what was the stage-by-stage process?
I took today morning itself, around 12 noon. Then after that, half an hour we...
Did you get a message? You got your message?
Yeah, I got.
And what did it say in the message? That this is the time you're going to get vaccinated?
Yeah, I got it message, and I got a call from call from government.
Okay.
Then they told me today you have going to take vaccine. That's all. It was a simple process.
All right, so great. You got the message. Dr. Shashank didn't get it, but at least you got it, so it's working. At least somewhere.
I got message.
You got your message. So you, in the message, you had the vaccination center written where you had to get vaccinated?
Yeah, already it's my hospital only.
Okay, in your hospital only. And was there timing attached with it?
Yeah, timing 9 to 5.
Okay, you can come anytime.
Yeah.
Okay, great. So you can go anytime. If your name is on the list, go anytime, show. And then when you reach there, you had to show your verification details, your ID card. And what ID did you show?
Any ID card like PAN card or Aadhaar card, anything else.
Okay, all IDs are accepted, all government approved IDs. Yeah? All right. So, and the whole process was how long?
Process for injection, for vaccine, it is not more than not more than 5 minutes. Then after that, we have to wait half an hour for observation room.
So it was seamless. There was no hiccups, no hitches, no queues. People were waiting. Were people waiting for hours, or was it quickly passed on?
Yeah. It was a simple process. Nothing.
Okay. All right, Julie, that was reassuring. Let me quickly cut across to Dr. Jitendra Nagpal, who is a psychiatrist, HOD, psychiatry at Moolchand Hospital, Delhi, to give us a perspective on the psychological impression that this vaccination drive really has on the country's population? When I say what does it really mean psychologically now that this vaccine is out? People are skeptical on one hand, people are motivated to get back to work on one hand. What is it that you've really come across, Dr. Jitendra? Now that the vaccine is out, it really gives us a whole boost in our morale. But that's really, again, not the entire population. There are many who say, no, I don't want to take it, let everybody else take it, and I'll take my turn once everybody finishes taking, and I'll oversee the side effects and then decide what to do. Some of them saying, I don't even want the Indian vaccine, I want the vaccine from the West. Some of this psychological imbalance that we see, many of them complaining on multiple fronts. So give us your perspective on the mental effects of the vaccine now that it's out.
Thank you, Nabila. I think it's been a very positive and a encouraging as well as enthusiastic day for India. I would say 16th January 2021 is being a historical day indeed. As you said, from the psychological perspective, I feel it's been a smiling India. It's been a very positive and smiling India. All through, we have come across people today, and the best part is there is, like the values, the Indian values, unity in diversity. I think I have seen so much of collaboration, so much of cooperation with each other between the healthcare workers and the officers and the workers, nominated for the vaccination. There has been a compassion. I think jisko hum samvedna or vinamrata kehte hain. There's a huge amount of brotherhood we saw today. People actually talking about the positive side of life and how the vaccination actually, marks the beginning of a country's thought process, the vision and the mission of a country ready to take on the crusade of vaccination and protect the entire 1.3 billion people. I think, to me, that has been a psychosocial support that we saw between the people, the community partnership today. And wherever we've come across people, the healthcare workers who received it, I think the courageous response, the fortitude and the enthusiasm that, okay, yes, I'm proud, so what? I came across a nurse who had a little, pain at the site, but then within about half an hour, she was very smiling. And all through, we could see people encouraging the others who went through the vaccination to remain positive and not worry, not have that anguish, the anguish which we saw in the entire.
So you're saying that this has brought in a lot of positivity in the mindset of people now that the vaccine is out. It's hope that we're finally taking a step towards ending this pandemic. Now that the vaccines are out,
indeed proud.
There are a lot of naysayers.
We are indeed proud as a nation.
Absolutely,
we're proud as a nation that today we
world's front runners now to have been vaccinated, undoubtedly.
Yeah.
Doctor,
we need to maintain this tempo.
Absolutely. I'd like to ask you now that the vaccination is out, there are a lot of people, until the vaccine came out, they were waiting for the vaccine. Now that it's out, they're so skeptical, going after those isolated incidents of adverse effects of vaccines across the globe. In India, largely today, what we need to be proud of and happy, relieved that there has been no adverse effect reported across any of the vaccine centers in the country. 3,000 odd vaccine centers and no adverse effect reported from even one center so far. What does that have to say, and how should that really mentally boost us and encourage us to take the vaccine?
I repeat that it's been so encouraging that we need to maintain the positive peer pressure in the community, and that positive, smiling, courageous and enthusiasm that also will have a lot of positive outlook to the whole process. Today is only the beginning of the protocol, beginning of the rollout, and we'll see weeks down the line the enthusiasm that is going to build up. So we all need to work together in the community partnership for the vaccination to help out the officials who are striving hard to make this a very important, successful mission for the country. And the general public, I can only say that, is very knowledgeable. We have kept our courage as a united nation for the last about 8 to 9 months.
But that's precisely what I'm trying to ask you, Dr. Jitendra. Here are some people, and word spreads like wildfire that I heard something like this happened. I heard it's not very safe for the older population. I heard some adverse effect somewhere in some other country. So let's not take the vaccine. So this kind of sentiment among people, how do you encourage them to think positive? Because it's also a lot of mental balance and a lot of mental conditioning that you need to put yourself through to put yourself in that spot to get vaccinated.
First of all, the day one has been so successful. We all know that no adverse event has been reported, and we all know, I think the newspapers and the electronic media has been doing a remarkable job in completely reaching out to the country and assuring that these are well researched. We know that both the vaccines have gone through a complete research protocol, and the entire nation is aware about that. So the facts and the figures need to be right to the public and the community partnership so that the rumors are not encouraged. I fully agree with you that somewhere down the line, people who are very worried and panicky, they can create a panic reaction in the community around them. So we should be discouraging people from spreading rumors, first of all. And also we hold a responsibility for giving a positive, encouraging response to the family system in the mohallas and the colonies, because that's where the leaders, the community leaders, including our MLAs and MPs, are likely to do a wonderful job in reaching out to the public and reassuring them. And don't at all get carried away by people
and I think the doctors have done a wonderful job by setting by example. They've set example. Doctors themselves have taken the COVID shot. So it should be reassuring that those medical professionals believe in the vaccine. Why shouldn't we? Jingam Carlo, staff nurse, Meteor Hospital, also gets the first shot today. I'd like to get to her. Jingam, what's your experience? Are you elated? Are you happy? Are you relieved? Are you finally mentally, come to a balance to meet your family without fear anymore after the vaccine today?
Hi, ma'am. I'm fully rejuvenated now, and I'm getting a full positive vibes after getting the shot, and I didn't get any side effects at all. It's completely fine.
Not even a mild temperature as expected, or a swelling in the arm?
No, nothing like that. A little bit of soreness, which we get after any vaccination, but then it's fine.
It's fine. Jingam, I'd like you to give us the immense amount of pressure that you had through the months while you were actually attending to your duties, facing COVID patients, getting back home to your family members. What was your daily experience and the mental trauma that you were put through? I'd like to understand from you, how was it through this pandemic for you and your family?
It's been almost a year now since the pandemic has started, and as we were the frontline workers, so we have to face the thing more than the others. So we on the daily basis we used to see the patients, and not only the patients, they suffered physically, psychologically, emotionally, because they were not able to meet their near and dear ones.
Right, your
family.
family
goes with us after doing the duty for whole day in the PPs. It is too hard to spend a whole day, around 12 hours inside the PP. So you will be fully sweating, and especially during the summers, it's too hard. But then one thing always encouraged me was we should never stop believing in hopes, because miracle happens every day, and finally the solution for this problem has arrived.
All right, the solution to this problem has arrived. Covishield and Covaxin, you had both vaccines available, but there wasn't a choice that were given to people. What vaccine did you get, Jingam?
For me, I had taken
Sorry? Can you hear me? All right, we're going to patch Jingam again. If I can cut across to Dr. Jitendra. Dr. Jitendra, people were not given a choice between Covaxin and Covishield. For your doctors at your own hospital, did everyone get vaccinated, and how elated are they? Do you feel the difference between the two vaccines matter at all? Because at the end of it, the formula of both these vaccines are totally different. Covishield has a different technique inside your body. Covaxin works differently in your body, but both are against, of course, to fight against COVID-19, but they're different formulas altogether.
There has been no debate about that. Both have been received very well across the country, even in our hospital. And I believe that as the government protocol is suggesting, we should follow that. And I think these are well-researched vaccines, and they have simultaneously come out for the public. And keeping the tone of the entire population in mind, I think we should be encouraging people not to worry about what is to be chosen and what is not to be. Let the government decide, let the let the union government decide the rollout and the nature of the distribution of the vaccine. I think we need to repose a lot of trust in the government for taking up such a mammoth Herculean task of reaching out to people right from day one. I think the protocol and the way the entire processing, the entire impact that has been created has been wonderfully and administratively carried out. So the choice of the vaccine is not the question. It is how the well-researched both vaccines are available to the public and they have an equitable platform to reach out, because we have to look at the numbers. We are going in millions and millions, and we are probably reaching the target, planned target for more than 1 billion people. So I think we need a support from both the products at the moment, and I think we should be completely cooperating and collaborating with the government in the rollout process.
Absolutely, and I hope the message echoes with the public at large. Thank you very much, Dr. Jitendra. Thank you, Jingam, and congratulations on getting your first COVID shot. Thank you very much, Julie. Congrats on your COVID shot. The process will continue. This was the first day where close to 1.5 lakh, a little more than 1.5 lakh doctors, frontline workers, healthcare warriors have got vaccinated. In fact, doctors were among the first, like I mentioned, to be inoculated. India did kickstart the world's biggest vaccination drive. Top doctors received the vaccine jab themselves, assuring others that it is indeed safe. Here's what we found through the day.
A shot in the arm in the fight against COVID-19. As India began the world's largest immunization program on Saturday, our doctors, who have been at the forefront of the COVID battle, were among the first ones to get the vaccine jabs. The top doctors, which included the AIIMS director, who got inoculated on the first day of vaccination drive, also urged others to step forward to get the jab once it is available to them.
वैक्सीन जो भी हमें मिले, हमें लगानी, क्योंकि तभी हम अपने केसेस जल्दी से जल्दी कम कर पाएंगे, मोर्टेलिटी कम कर पाएंगे और वापस back to normal आ पाएंगे.
Today is the largest vaccine exercise in the world. So this is a significant day, and I wish all of us who are getting it now, all the frontline workers, they have actually been risking their life for the last 10 months. So this is the beginning of the end of the pandemic.
Frontline healthcare workers are now getting their shots, and we are at the prestigious Medanta Hospital. 2 doctors who were involved in the war against COVID-19 are amongst the first to get the shot. With me is Dr. Arvinder Soin and Dr. Yatin Mehta at the Medanta Hospital.
We need to serve as examples for the rest of the country that they should embrace the concept of vaccination. They should not hesitate or be afraid. It is safe. We've just got it. We are doing well so far, and hopefully it'll go great.
Both the vaccines are safe. There is some data which is expected from the second vaccine, which is the Covaxin. But the safety is not an issue at all.
Doctors who have put their lives on the line to save others are again at the forefront of building confidence among the population concerning the safety of vaccines.
I'll tell them that in unusual circumstances of pandemic such as this one and previously in Ebola and other situations, scientific paradigm allows you to take extraordinary decisions. And those decisions are again based on logic, and invoking those decisions, the Covaxin has been given emergency use authorization. We are following the protocol prescribed by the drug regulator, but it is to be scaled up. It is to be given. We cannot wait. India has now choice of 2 vaccines.
The government is also aggressively putting out the message that both the vaccines are safe.
नमस्कार, नया साल कोविड-19 वैक्सीन के रूप में आशा की नई किरण लेकर आया है। भारत में बनी वैक्सीन सुरक्षित और प्रभावी है और कोविड के विरुद्ध हमें प्रतिरोधक क्षमता देती है। इसीलिए भारतीय वैक्सीनों पर भरोसा रखें।
The existing caller tune featuring the coronavirus public service announcement has been replaced with a new message on vaccine safety.
दोनों वैक्सीन स्वदेशी हैं, पहली बात। दोनों वैक्सीन भारत में बनी हैं। दोनों वैक्सीन बराबर सेफ हैं, इफेक्टिव हैं, इम्यूनोजेनिक हैं।
But Union Health Minister Dr. Harshvardhan asked them to not jump the queue and wait for their turn.
देखिए, डॉक्टर हर्षवर्धन अपनी बारी का इंतज़ार करेंगे। डॉक्टर हर्षवर्धन डॉक्टर तो हैं, लेकिन अभी किसी अस्पताल में मैं अस्पताल के हेल्थ केयर वर्कर की तरह काम नहीं कर रहा। इसलिए मेरी बारी आएगी तब जब देश को 50 साल से ऊपर के लोगों का वैक्सीनेशन मिलेगा।
Now that the vaccine has been rolled out, the next big task is to focus on logistical challenges in the vaccination drive of this mammoth scale. With Gaurav Sawant in Delhi, Bureau Report, India Today.